Welcome back everyone. It's our afternoon session. We'll start with conclusion. Tell us about it. Thank you. Yes.
Does this thing work?
Yes.
Hello everyone. I'm Nderim Gerguri, and the thesis is how to make the pediatric department and clinic in the regional hospital of Mitrovica the best healthcare provider in Kosovo. Initially, before I started to do my project, I had many thoughts and I wasn't sure which one I was going to do. So randomly, once I just opened Maslow's rule and going through all the 5 needs every human being has, I saw that the health department was the one that needed the most improvement. At the same time, unfortunately, my grandfather was diagnosed with cancer, and I had the opportunity to go and visit the main hospital here in Pristina. After being at the hospital, I thought that the one and only reason why the hospital wasn't performing was that there needs to be more financing. And I started the project thinking that there needs to be more financing in this particular department. So I slowly started to do research and started to compare data between Kosovo, the countries in the region, countries in Europe, and the United States, and see how much each of these countries spend on their healthcare. As you can see from this graph, the United States is by far the country that invests the most, followed by the other Scandinavian countries. Many of these countries spend up to 30% of their entire budget to provide better healthcare services. To see how much Kosovo spends, I went through the finance or the publishments of the Ministry of Finance and saw that our government spends the most in infrastructure, mainly building roads which connect Kosovo with Albania and now with Macedonia. Randomly, at the same time, I saw a picture of one of the best artists here in Kosovo. And he discussed the opportunity cost and the fact that many of the citizens in Kosovo lack the primary needs of every citizen. But at the same time, our government, instead of spending in water, as we know, Pristina doesn't have water all the time. There are only 8 hours a day, which the majority of the city has water. Many times a year, the lights go off because A.U.K, the main provider of energy, it doesn't function really good. And the healthcare is in really bad conditions. You just have to go to any hospital here in Kosovo and see what the conditions are. At the same time, instead of investing in these departments, our government is investing in roads which cost hundreds of millions. And the last one cost approximately $1 billion. While conducting the research, I went to the hospital of Mitrovica. I have some relatives there. The guy that leads the pediatric department is a cousin of mine. He's a famous doctor there. And then started going through the different data provided by the hospital and different websites online. Since the end of the war, in 1999, the death rate for children has increased significantly. As you can see from this graph, Kosovo has the highest infant death rates compared to the region and Kosovo. I went to the hospital at the gynecology department and asked them why was this the case. They told me that they needed equipment, they've now been independent, and now they are slowly fixing this ongoing system. Afterwards, I went back to the hospital in Mitrovica and checked their finance. As I told you initially, I thought that finance was the only problem. As you can tell, they are not doing so bad financially. But when talking to Dr. of course, there is more financing needed. There are a lot of other problems. Another problem is that some departments are overstaffed. Even though they don't have a lot of patients daily, there are overstaffed. There are more doctors, there are more nurses. It is general knowledge that for every patient there needs to be one doctor and 4 nurses. In this case, there are departments that lack doctors, that lack nurses, there are really long lines, whereas there are some other departments that are overstaffed, that have a lot of doctors, there are a lot of nurses, but not a lot of patients. This comes as a consequence of nepotism, family connections, and so on and so forth, the way that things function in Kosovo. Besides overstaffing, one of the main issues that I will talk about later is the way that the Ministry of Health and Ministry of Finance finance these hospitals, these regional hospitals in Kosovo. While talking to these doctors, they told me that worldwide the budget is mainly financed by the main hospital, because there are people that work in the hospital, Mitrovica, the clinic of students here in Pristina. There are professionals and know the needs of their patients. When I went to Mitrovica, I surveyed patients. I surveyed approximately 40 patients, even though they were hesitant, because they thought that what they were going to say will have consequences in the way that doctors treated their children. I collected data online and I surveyed Dr. Nderim Gerguri, who is the head of the department, and Besad Nerotsi, the doctor in that hospital. What these doctors told me that the main problems is, as I mentioned, the budget should be channeled by Mitrovica, not the Ministry of Health, because of the way these funds are channeled. A lot of lack of medical protocol. To me, this was the fundamental problem of this hospital and every other hospital in Kosovo. I went and checked different hospitals in the States, Norway, and other hospitals that provide the best outcomes, and they all have a universal medical protocol. This itself is the foundation of many problems between patient and the relation doctor-patient, doctor-doctor. Because a lot of parents, they send their kids to a doctor, they prescribe a certain diagnosis. At the same time, the doctor leaves for his location, they go to another doctor, and he prescribes a completely different diagnosis. This leads to a lot of problems because the patients don't know which doctor to listen to. This leads to a conflict between patients and doctors, at the same time between colleagues, doctors themselves. Besides leading to a lot of conflicts, having a medical protocol leads to a more efficient and effective procedure. Besides the lack of a medical protocol, absence of the essential medical drugs is another issue. You can see in this graph, after I conducted the survey, most of the patients were not satisfied with the drugs the hospitals provide. In many cases, they are forced to go to the pharmacies, to the drugstores nearby the hospital, and buy these essential drugs themselves. There is another picture by the same artist who describes the entire medical healthcare here in Kosovo. Other problems described by Dr. Nerotsi are the absence of lack of equipment and no space. Imagine that region of that department, that clinic, doesn't have an X-ray machine. So if you send a kid who is really young, he might have broken a bone, you have no chance of finding out whether he has broken a bone or has any illness or disease. In this case, doctors are forced to send their patients to the private clinics nearby or to the hospital here in Pristina. Besides the absence of the X-ray machine, they have no incubator. Incubators are crucial for the newborn babies, especially if they are born with certain diseases, let's say, are born early, you need incubators to provide better services. And besides incubators, there are not enough beds for the mothers that have just given birth to these babies. Another component, another reason why this hospital, why this clinic doesn't work properly is the education of the entire community. Anyone who has doctors in their families can tell that the problem is usually initiated by the patients themselves. They hesitate to communicate what they have done with their kids. In many cases, they listen to a lot of superstition and give give drugs that are not prescribed by doctors. They are mostly now willing to communicate with their respective doctors. Besides that, up until now, a lot of mothers that live in these regions, in the municipalities, in the villages, were now willing to go to the hospital. They were mostly giving them at their houses. As we know, the conditions are nowhere compared to being in a hospital. Later on, I will list what these doctors suggested that needs to be done in these certain departments. I already showed the satisfaction with the medicine provided. So here I have listed the final recommendations by these doctors and what I have found online that are crucial to a better functioning health system in this particular hospital. Initially, as I talked about, having a medical protocol is a necessity, not only for the hospital in Mitrovica, but for all of the hospitals here in Kosovo. This should be a universal medical protocol which would ease the lives of doctors and patients as well. Having a mechanism which rewards and or punishes doctors based on their recorded results. This is another crucial component. Nowadays, many doctors are working in the public and private sector. But the public sector right now is only intermediate to send their patients to their private ordinances or clinics. What these doctors suggested is that the hospital in Mitrovica already has an electronic system which records the data. And what they suggested is use this data that they have already recorded, and through this data, reward doctors that are hardworking and have many patients daily. And in the meantime, the doctors that perform better than the others will be asked to work more. Like patients, when they go and send their kids to the pediatric department, they can have the ability to choose. They can have the option to choose which doctor they want. So the doctors that are working more will receive a higher salary based on their daily visits. Besides this mechanism, which will slowly shift the focus from the private sector to the public sector, having the necessary equipment is also crucial to the hospital. As I told you previously, incubators, there are no incubators whatsoever. There is not an X-ray machine. There are not enough beds. And what's the worst, there are not enough essential medical drugs. These essential drugs need to be provided, regardless of how much finance the hospital receives. Education, as I mentioned earlier, is also another obstacle for the doctors and patients themselves. Educated classes must be taught since the primary school, since the elementary school. They should have basic knowledge about the entire process, about the pregnancy, about hygiene, about how to raise a kid after he's born, how to check his temperature, giving first aid. A lot of this is not present nowadays. Most of the Albanian mothers or mothers in Kosovo don't have the basic education when it comes to taking care of their kids. Besides taking classes in school, since the elementary school and high school, there should be additional learning centers. Worldwide, we have the centers which teach both parents how to deal with mother's pregnancy and what to do after a kid is born. As we know, there are a lot of dangers for the newborn kid. You should know nutrition is also a crucial component, which mothers in Albania, parents generally don't take care of whatsoever. What doctors suggested to is initiate debates in the community. The debates in the community are non-existent. Therefore, doctors suggest that there should be at least once a month or once in 3 months a debate between patients or people of that community to the doctors, or at least the heads of the main clinics in these hospitals. Besides this, what Dr. Nderim also suggested is that this is mostly related to this clinic, provide special encouragement, like encourage doctors to specialize in certain diseases that kids are prone to. For example, chickenpox is common in Kosovo. Cystic fibrosis is common worldwide, and most of the people in Kosovo don't even know what it is. Bronchitis, and a lot of other diseases which these doctors can do their PhDs. So they have a lot of kids with these diseases. They can take these kids as samples and provide suggestions or scientific knowledge how these diseases should be cured. Thank you for your attention. If you have any questions,
Questions, please? Can you tell us a little bit, how, when you said you were interviewing 40 patients, how did you approach them? You mentioned how they're hesitant. How did you handle that? Were you satisfied with how you got in the end?
Well, how it works is you usually have to tell them who you are. My grandfather was one of the first Albanian doctors in that region. So as soon as I told them that I'm his nephew, it was like they weren't as hesitant as they initially were. So they have to know your family. If they know who you are and that you won't betray them, then they are willing to share their opinions. Otherwise, it is really difficult. As a culture, as a community, we are hesitant because we think of the consequences, and we are not used to being prone to these surveys. We have started being surveyed recently. Like we didn't even know what a survey was prior to that.
Did you feel you had enough data on those 40 patients? Would you like to know that more?
Yes. I mean, time was an issue. I was working full time, and I had classes since 3:30 up till 8. So I mainly interviewed these patients during the weekends, on Saturdays mostly. Otherwise, if I had more time, I would interview more patients and I would get more opinions and a closer look to the problem. Nevertheless, I had an opportunity to go and talk to Dr. Brian Rossi. He has been a part of the hospital. And I remember first time I called him, he was frustrated. Like, he was not working with the hospital. He was like, everything's not working. You need to come here and see the improvements that need to be made. Also, I forgot to mention that the Embassy of Norway is financing the hospital. I mentioned it in my project, and they are building a new building for the Pediatric clinic, and hopefully they are going to have the necessary equipment, starting from incubators and X-rays to have better performance as a department.
I know too, I mean, you're only looking at Mitrovica, but do you think the other regional hospitals, I mean, all the facilities, the needs that are there, are the other regional hospitals very similar, do you think? Or you're not really in a position to say?
Well, this might be the assumption. I was born and raised in Kosovo, and I see that these are the main hospitals, these are the main problems that every hospital, every department faces. But what I think is more, the pediatric department is more fragile because we need to take care of kids and newborn babies. And there are some other things that we need to take into consideration compared to other departments.
Any other question?